Hey, you. Yes, you. Are you in the childbirthing years of your life? Are you a female under the age of 65 and having menstrual periods? Are you on birth control? If so, are you on the right birth control? Have you heard about those little thingies that the doctor puts up in you? Are you skeptical about having a birth control device inside of you? Do you have heavier than normal menstrual bleeding, or are you just tired of trying to remember to take a pill at the same time every day? If you said yes to any of those questions, this public service announcement is for you.
Let's start by talking about your menstrual period. Let's face it, nobody wants to talk about it, period. But you know what? We have to. Heavy menstrual bleeding is a common cause for iron deficiency anemia, and it affects a woman's quality of life. It also causes some women to be less productive at work and results in spending more money on feminine products and doctor visits. I bet you didn't know that heavy or abnormal uterine bleeding is one of the most commonly reported symptoms in premenopausal women, and it accounts for almost 60% of consultations for menstrual disorders. So you're done. You're done altering your lifestyle so you're not embarrassed in public anymore, and you're done spending more and more money every month on feminine products and new clothes. And you're done hearing your alarm clock go off because it's time to take your pill. You absolutely deserve a better quality of life. So it's time to get some help. Time for a different method of birth control and controlling your heavy bleeding. Expect your doctor to complete a pregnancy test and a pelvic exam in order to check for any atypical causes of your heavy menstrual bleeding or contraindications for an intrauterine device. Okay, so let's talk about the different intrauterine devices, or IUDs. They just about eliminate your chances of getting pregnant and or reduce heavy bleeding during your menstrual cycle. Depending on your medical needs and personal preferences, you'll have to choose between one of the two types of IUDs, the hormone implanted IUD or the copper IUD. The decision about which one is best for you can be based on your personal situation, your medical needs, and your doctor's advice. First, let's go over the basics of the hormone implanted IUDs. There are only a few differences between the name brands: size, amount of hormone implanted in the device, and how many years it's good for. The most common devices are the Mirena, Liletta, Kyleena, and Skyla. The Mirena and the Liletta are implanted with 52 milligrams of the hormone levonorgestrel, while the Kyleena and Skyla have 19.5 and 13.5 milligrams respectively. The first three are good for up to 5 years, while the Skyla is only good for up to 3 years. Studies have shown that the hormonal IUDs are the superior method for treating heavy or abnormal menstrual bleeding and result in reduced blood loss when compared to other treatment methods. These IUDs act locally on the uterus and essentially cause a very stable environment without the typical monthly shedding of the uterus lining. Common side effects include shorter, lighter menstrual periods that may actually stop altogether. Next, let's go over the non-hormonal IUD, the Paragard. Patients often choose the Paragard because they have very manageable bleeding during their periods, or they prefer not to have additional hormones in their system. The Paragard releases small amounts of copper instead of hormones that interfere with the sperm transport, fertilization, and possibly implantation. If you do not have heavy or abnormal uterine bleeding, the copper IUD could be right for you. It does not have the implanted hormones, so your monthly period will still occur and it has the potential to slightly increase vaginal bleeding. It is only slightly larger than the other IUDs and it can last up to 10 years. Each IUD has a slightly different method for insertion into the uterus and should only cause mild discomfort. The patient may also have some mild spotting afterwards. The overall efficacy of any IUD is over 99%, with some studies showing that only 0.03% of women get pregnant within the first year. One good thing about any IUD is that it can be removed at any time if you decide you want to get pregnant. Let's face it, the goal here is to get you back into a high-functioning, high quality of life that is as normal as possible by reducing troublesome symptoms and or preventing pregnancy. High quality time with your family, kids, and loved ones, doing the things you love the most is what's important. Hope you've enjoyed this public service announcement, and remember, you should always consider an IUD for your medical needs. If you have any other questions about birth control, heavy menstrual bleeding, or IUDs, call the number below or email us at www.theiudclinicsrus.com.